Well, good afternoon. Really great to be in Pahokee. I think the last time I was in the area was when we were doing some stuff at Lake Okeechobee. We've got a great group of folks here. Superintendent Donald Fenoy from the Palm Beach County School District is here. Do we have Mayor Steve Wilson here? Yeah. Is he here? Where are you? There you go. Thank you for coming, Mayor. And then, of course, I have one of my great agency heads, John Davis, who is proud favorite son of Pahokee, former FSU football player. And so I want to thank Secretary Davis, and then Anquan Bolden, who really, Anquan working with John Davis, identified a need. John brought it to us, and we said, all right, we're going to figure out a way to get some vaccines into the Pahokee area. So I want to thank Anquan Bolden for his leadership, and we're obviously right here at Anquan Bolden Stadium, and we're going to be able to announce that we have a pod here. We're going to be able to do at least 500 vaccines for seniors in the Pahokee area, which we think is very, very important. Palm Beach County, if you look at the total shots administered, and the reporting lags on this, so it's really 4 or 5 days behind sometimes, but if you just look right now, Palm Beach County has almost as many shots administered as Miami-Dade County, and Dade is a lot bigger. Now, obviously, Palm Beach has a higher percentage of seniors, but we've been able to do a lot in Palm Beach with the pods at the senior communities like Kings Point. Publix has over 60 locations. We've also had hospitals in the fight, and then now being out here in the western part of the county, we're trying to cover all the bases. And so I appreciate folks pushing to get vaccine everywhere they can. Palm Beach has been able to get a lot of vaccine. We're going to keep it going. What we've tried to do is understanding, particularly when you're dealing with the 65 and up population, that not everyone is going to be able to get the vaccine in the same way. They may not have all access to get to the same places and all this, and so we try to account for that. So what we've done, in addition to, we're now in over 350 Publixes, not every county in the state. Palm Beach is one. We just announced Pinellas and Pasco that'll start tomorrow. We've had the Panhandle, we've had Volusia, we've had Southwest Florida, St. John's, Flagler, Brevard, a bunch of other counties that have done it. It's been great. The hospitals have done a lot. What you're starting to see now is a huge increase in second doses that are being administered. If you know, when you start seeing the first doses really rocket at the beginning of January, just fast forward 3 or 4 weeks, 3 weeks for Pfizer, 4 weeks for Moderna. So you're now in that part where that Moderna is really coming due. And so you're going to be seeing, by the time the reporting's complete, you'll be seeing 50, 60,000 second doses daily. And a lot of that is being done by the hospitals because they got the initial shipments almost exclusively. So that's a good thing. If you know with the research, once you hit the second dose and you give it about a week afterwards, 7 to 10 days, the protection against infection is like 95% for Pfizer and Moderna. And so that's a huge, huge thing. So we're getting to the point where you're going to start having hundreds and hundreds of thousands of seniors that not only have had the one dose, but have had both doses and then have that really, really good protection. So we're doing that. We've also done partnerships with a lot of houses of worship throughout the state of Florida. We've done over 25 different churches in 15 counties, and that's vaccinated over 13,000 individuals. These are predominantly churches in the African American community. And then this week, we're going to be visiting another 30 places of worship and partnering with more than 150 faith-based communities at various locations. Still a lot of African American churches. Also going to have, we're going to be at a synagogue. I know some synagogues in South Florida. So really, I think it's going to be the whole mosaic of faith-based community coming together to help vaccinate our senior citizens. And we look forward to doing more as the time goes. So I've talked about this a little bit, but we had been getting throughout January about 250,000 to 266,000 new doses every week. But if you look at the doses that have been administered, we've been doing far more than that. This week we've gotten about 307,000 doses, so we're up about 40,000 from where we had been. And we were able to do some stuff. We did some additional pods. We've done some additional drive-through. We're trying to replenish some of the hospitals as best we can. But those doses are going to be gone. I mean, the demand for that far exceeds 307,000. So we're using them. As you get more, we're going to be able to do more. We are going to see some with the federal pharmacy program, with going directly to some of these pharmacies. Now, obviously, we're doing some to Publix with the state allotment, but this would be an additional allotment above what we're getting, which we could go to places like Walmart, Winn-Dixie. They may still do some Publix. I don't know how they're going to do it yet, but that'll be another great thing to be able to do. But that's really where we're at. We get about 307,000 this week from the federal government. There's not vaccine just sitting around. It's whatever's here is distributed, and the goal is to get it into people's arms, and that's what we're doing. Our strategy is going to continue to be seniors first. Seniors first. We have 4.5 million 65 and up throughout the state of Florida, and we have probably, if you count for the reporting delay, we've probably given shots to about 1.5 million seniors. I think it shows up as about 1.3 million, but there is reporting delay here. Either way, that's number one in the nation by far. No other state even has 1 million, and we're about 30% of all seniors in Florida have received at least one shot. Now, obviously, we want to keep going. It's not going to be 100% because I don't think 100% are going to opt for it, but we do think the majority of seniors are going to opt for it, so we're going to continue to do it. But that's going to be the goal, getting every senior who wants a shot. They get a shot, and then at that point you'll be able to start looking into some of the other areas. I know there's a lot of folks in the workforce. I know there's others who will be able to do it. From the very beginning, though, it's important to point out, with my order in December, that we always said hospitals can be giving this to people that are very vulnerable to COVID regardless of their age. And so I know a lot of hospitals have gone to like their cancer patients and all that. They're still authorized to do that. So if you have somebody that is over 65 and is especially vulnerable, clearly you want to vaccinate them. But if you have somebody that may not be quite that old but has some conditions that really could be aggravated by COVID, hospitals are of course permitted to be able to do that, and we trust their medical judgment on that. Johnson & Johnson. It's really important for people to understand, because sometimes these things get portrayed one way or another. I was seeing a lot of reports saying, oh, not as good as Pfizer and Moderna, 67% of efficacy. Actually, it was a lot more than that in the U.S. It was closer to 80%, but they averaged all the figures from around the world. So let's just call it that. But that is efficacy about completely preventing the infection. What they found was after 28 days of taking the Johnson & Johnson vaccine, it was 100% effective at eliminating death. And it was close to 100% effective at preventing hospitalizations. And so what that means is one dose, 28 days, no freezing, none of that. After one dose, you effectively convert COVID from something that could be life-threatening to certain folks, particularly elderly people or folks with health conditions, and you take it to something that maybe you have a cold-like or flu-like symptoms for a couple days. So that takes it from death or severe disease down to something that would not even require you to see a doctor or go to the hospital. So that is a very good tool to have. I think the results were fantastic. I'm looking forward to us being able to get some Johnson & Johnson vaccine when the emergency use authorization is approved. We assume it's going to be approved based on the data that we're seeing. So they're probably going to file. We think they'll file this week, hopefully. And then you're looking at an approval in 7 to 14 days after that. We're not sure how many doses are going to be ready to go at the outset. They're going to do 100 million of them, but I don't know that that's going to be done for another couple months. So hopefully they're able to distribute millions of doses throughout the country. We welcome that in Florida, and we think we could put that to good use. Look, the seniors who want the Pfizer Moderna, that's fine. If that's what you want, that's what you want. But this J&J is a great tool, and I think it's something that, particularly if it gets produced at a bigger scale, you're going to be able to use that for police officers, for teachers, for all these folks, and it can be really, really good for us. So I'm excited about it. I think it's really, really good. And finally, let me just say, before I introduce some of our speakers, since December 1st, Florida, on a per capita basis for cases and hospitalizations, have been 30 out of 50 states. So 29 states have had higher per capita caseloads and higher per capita hospitalizations than the state of Florida. Yesterday's hospital census was, I think it was like 5990. That's down. Man, that's probably down 25-30% just from the middle of January. Part of that is just the natural seasonal flow of this virus. It's behaving pretty much similar like a flu would behave in terms of when it peaks and when it goes down. The only difference is there's really no flu cases anymore, and so the pediatric respiratory hospitalizations are down sharply year over year, which is a really good thing. I mean, COVID is obviously more of a threat than influenza for seniors, but for kids, the hospitalizations for respiratory viruses are way down. You will have fewer throughout the United States deaths from respiratory viruses from minors as a result of influenza being displaced. But that's where we're at. You're seeing it go down all across the country. Probably most of that is the seasonal effect, but the more vaccine we get out there, I think that will pretty much guard against there being a sharp increase like you saw in New York last March, or like you've seen in California recently, or even like the Sun Belt at a much lower level that we experienced over the summer. So all in all, I think people should be really optimistic. I know the demand is still a lot higher than the supply. Trust us, whatever the federal government will send us, we're going to get out there. We want to get as much as we can because I know a lot of folks want it. The good news is we have a lot more seniors that have gotten the shot today than if you go back a month ago. We really had just begun doing seniors. We had done a lot of the nurses and the doctors, and then also the nursing homes, which is very important. And so we've made a lot of ground up, and I think we can make up even more based on how much we're able to get into the federal government. So today, though, I think is great. When Anquan Bolden talked to John, they know each other from being from here, and they're both great football players. John came to us and said, is there any way we can make this happen? And I'm like, we need to make it happen because we have done a lot of good things in Palm Beach. All these Publix, people like it. It's doing well, but they don't have access to that here. So we want to make sure we work on getting access to communities across the board. And, when you look at what Anquan Bolden has done, this guy's had a hell of a career in football. I mean, Mr. Football, legend here, Florida State, national champion, All-American, NFL, All-Pro, Super Bowl, you name it. Guys do all that, and you have a nice life. He has a nice life, but he could just be doing it all about him. And yet he's relentless at getting things done. He's never forgotten where he's came from. He cares about this community in particular. And to see that and to see someone that came from a small Florida town to do so many great things, but all the great things on the football field is just really the tip of the iceberg from the lives he's been able to influence and affect in a positive way. And he really has a servant's heart. So I'm really glad that he was looking out here. I'm glad he reached out to John, and we're glad to be able to have him here and just to thank him for all he's done for the people out here in Western Palm Beach County. But really, he's helping kids all over the place. So Anquan, you want to say a few words?
First of all, I would like to say thank you to the governor. Seeing that there was a need there, he addressed it. If it wasn't for John, this day wouldn't be possible. I know the governor said a lot of great things about me, and I appreciate it, but this is more than just about me. There's a lot of people that made this day happen. All of the mayors from the area, South Bay, Belle Glade, Pahokee, Guardians of the Glades, like I said, John Davis. He's just a phone call away, and as soon as I called him and gave him the message, he said he'll get right on it. And this day happened because of John. So I really appreciate him in the governor's office for their quick response. We always feel like, or at times we feel like out in the Glades we're we're forgotten at times. And thank God that we have people they're willing to step up and fight for the people out in the Glades. This is home, always has been home, always will be, and it's my job to make sure that the people out here are taken care of. So again, I just want to thank the governor for his quick response and how he addressed the need that we have out here in the Glades today. Thank you.
Thank you. Good job. And I am also proud to be able to bring up Secretary Davis. John's a great guy. He, I remind him, I always ask him, I know the answer to it. I was like, were you on both wide right teams? And he's like, yeah, when they lost to Miami both those years. But, it's those were outstanding seasons for Florida State. So, yeah, he was a great football player. He's been in the private sector, got a great business sense that he's been able to bring to the lottery. We're working on a lot of innovative things. So y'all are going to probably hear some pretty interesting things maybe over the next few weeks. And I think it'll really help put the state in even a stronger position. So John, as one of the favorite sons here, he saw the need when he was told. He came right to us, and I'm like, we got to figure out a way. I mean, we'll get it done. And so we're glad that he stepped up as well. So John, come on.
Well, I'll tell you, we could actually just drop the mic. I mean, just listening to Anquan and the things that the governor has had to say, I can say I'm blessed. I'm blessed and fortunate enough to be in a position like this, to be able to give back. Ultimately, that's what it's about. It's about being able to give back. And being from Pahokee, born and raised here, I've said over the course of my career, when the opportunity presents itself for me to be able to help, I will. And when Anquan called, I mean, it was a no-brainer. I've had a chance to engage with my family members here and to be able to engage with the governor and the staff there in Tallahassee. And it was just a no-brainer. I'm fortunate to be a part of the governor's team, and I appreciate him having the confidence in me to appoint me to head up an $8 billion agency, being the Florida Lottery. And to be able to have the relationships that I have with individuals like Anquan, and I'm almost speechless. I mean, it's just such a beautiful thing to be here. And as Anquan mentioned, we talked about it within 24 hours. We were on a call talking about what needed to be done here. Within 48 hours, the governor was saying, make it happen. And that was only because we needed to get our ducks in a row and to make sure it was something that can be done. And this happened a lot quicker and a lot sooner than anything that I could imagine. And I just want to give thanks to the people here, to our mayors, to Mayor Babb here in Pahokee and others, and those that have volunteered their time to be here today to pull this off in such a short period of time. And again, I just want to say, we're just blessed. It's nothing like being back here on this muck. I was sharing with the governor on our ride over. It was my first time that I'd been back to the muck from Palm Beach. Since living in Orlando is normally when I'm making the trip. But this is a beautiful thing to be here at Anquan Boldin Stadium on such a very important occasion. And again, I just want to say a thank you to everyone that's here, and we're blessed to be here. Thank you, Governor.
All right. Thanks. So, here we are, Wednesday. Got a pretty big game for the state of Florida on Sunday. We're happy to be hosting 2 Super Bowls in a row. And I am happy to go on the record and predict a Tampa Bay Buccaneers Super Bowl victory. Tom Brady will be his 7th Super Bowl, and the only time they've ever won, a team has ever won in their home stadium in the Super Bowl. And so I think a 43-year-old quarterback who is already, in my judgment, the GOAT, coming here into winning will be one of the greatest team sports achievements of all time. In fact, in NFL history, if they can do it, you would say Dolphins undefeated and the Bucs with Brady, maybe 2 of the best. And so I have to put my secretary on the spot and who your prediction is for the Super Bowl.
Tampa Bay Buccaneers.
Okay. Anquan, do you want to weigh in?
Uh-oh. I'm going with my heart.
Yeah, I'll save my prediction.
Sometimes it's better to sit on the fence. So, well, I think it's going to be good. So we'll take a couple questions. Yes, sir.
Mr. Governor, what are your comments regarding the audit requested after several vaccines were spoiled, unfortunately, here in Palm Beach?
Sure. So this morning, the Surgeon General, the Secretary of Department of Health, put out notice that there's going to be an audit for the Palm Beach County Health District upon reports of some of the vaccines being improperly stored and therefore spoiled. I think it's 100% appropriate to do. We know that there are certain storage requirements with these. Obviously, the Pfizer has more stringent storage requirements, but the Moderna also has certain requirements, and people are very conscious about that by and large. So I think we need to get answers on that. The one thing that what I think a lot of folks in Florida have done a good job of is, okay, you store it, then you open a vial. And so say we have enough people have appointments, they're going to come, you have these doses. Well, say 2 people decide not to show up. Well, you have 2 doses. You can't just put it back in the freezer. You got to use it. So the guidance has been, find somebody who needs a shot. It's easy in like a Publix because you can just walk up to someone who's 65 and older and ask them. But even if they're not, get it in someone's arm. Don't let any of it go to waste, especially given how much demand there is for it. So hopefully we'll be able to get some answers on that. But yeah, I think it was really appropriate. Yes, sir.
Governor, one of the reasons you had to set this all up was because there's no Publix around here. And in Miami-Dade and Broward, in black and brown neighborhoods, there's no Publix either. So why aren't you using Walgreens or CVS as an alternate? And forgive me, but some say because the Republican Party gets a ton of money from Publix.
Well, yeah, well, that's not true. First of all, we use CVS and Walgreens to do the long-term care facilities. And so when we got that very first week of the Pfizer 5, the hospitals, part of those doses went to CVS and Walgreens to do the long-term care mission. Remember, we were the first ones to vaccinate anyone in long-term care facilities because they weren't scheduled to start for a week after the doses arrived, CVS and Walgreens. So I said, look, we're not going to just sit around. So we had these teams. We started doing it. They did 105 nursing homes in Broward and Pinellas County, 2 very elderly, high concentration of nursing homes. So we were able to knock that out. But they have been getting doses to do all of that. So we have used CVS and Walgreens. Publix is actually not in Dade and Broward yet, partially because the doses are still so limited. If I had unlimited doses, we would give it to everyone who wanted it. It's a matter of when you're talking about 266,000 doses, which is what we were getting for most of January every week. Yeah, you got to be able to make decisions. The things that the Publix offered us was being able to get in kind of medium-sized counties with high elderly populations in places that didn't have as strong of hospital systems. So one of the first hospitals to get it, or two in South Florida, were Jackson and Broward Memorial, 2 safety net hospitals. They're serving everybody in the community, and they've done a really good job of getting those out. So we've done it. Now, what's going to happen in Broward, Dade, and then some of the other counties who don't have the Publix yet is if the federal pharmacy program, if that ends up working out and we're getting 30, 40, 50, 60,000 additional doses, well, then you can get it into all of those areas, and you wouldn't be just talking about Publix. You could talk about Winn-Dixie's. You could talk about Walmart's, which I think would be really, really good. So, yes, we absolutely want to do that, and we'd love to bring it to Broward and Dade as well. But at the time, Broward and Dade were doing a lot of doses. In some of these other areas, they just weren't be able to do as much because they didn't have as robust hospital systems. Yes, sir.
Governor, we have the Palm Beach County Superintendent behind you, and I know a number of other superintendents on the Terrible Coast have also reached out to your office trying to make teachers a priority for the vaccine. Has anything changed? Will they be considered essential to get that vaccine sooner rather than later?
So the question is about other folks other than the seniors, will they be a priority? And the answer would be teachers, police, all that, of course a priority, but the question is who needs to be the top priority, and based on the evidence of how this virus has affected different demographics, seniors first is clearly the right policy. So we're going to continue to do that. The Johnson & Johnson vaccine gives us potentially the ability to start offering it to folks who are in the broader community, and we want to do that, and we know folks have been doing it. But if you look at the mortality for this, 80 to 85% of COVID-related people that die with COVID are 65 and older, and that's really, I think, as you get that population vaccinated, that puts the downward pressure on the hospitalizations, and that will save the most lives. So they are a priority. Seniors First is our first priority. If you gave me 1 million doses, we'd be able to get through the seniors quicker, but we're going to get there, and we're going to be able to offer it to a broader population. One more. Yes, sir.
Who paid for the doses here, and what are you going to do after today to try to get vaccine to Pahokee and Belgrade and South Bay?
Well, so the question is who paid for it. Well, all the doses just come from the feds, and then we have to make whatever determinations. When we saw the need here, what we did was we had a very small number of doses at the Department of Emergency Management that we use to fill gaps if something happens or you need more. So we were able to scrounge, we were able to figure out where could we take from to be able to get it down here. But I'll tell you, it was not easy to do just because there's so much demand for it. And so we're happy we're able to do it. The second dose for everyone who gets it today, the second dose that's already budgeted for, it hasn't arrived yet, but when that arrives, you will have your second dose. I know there's some people that say, well, wait a minute, some hospital has 10,000 doses sitting there, they should be used. Well, they are being used. They're just used as people come in for their second doses. The shipments they view them as distinct shipments. So when I talk about we're getting 307,000, those are initial doses for new people to get vaccinated. We do get whatever our allotment will be for the Pfizer, Moderna for the second doses, but obviously those are people that are already in the middle of the regimen, so it's not like you're getting new folks with those. But keeping the second doses available for folks, or as they come in, making sure they get where they need to go, that's really important. The first dose does give you some protection. I think that's pretty clear in all the clinical data, but it is not in and of itself going to get you to the 95%. We want that 95%. I've been able to visit sites. I've been able to go to drive-thrus. I've been able to go to Publixes. I've been able to go to this. And the number one thing I hear from seniors is, I just want to be done with COVID. I just want to get my 2 shots, and I want to be able to do the things I used to do. And that second shot, gives you that really strong protection. And so we think it's very important. So all the seniors that come through here today, and when the time comes for the second shot, all these folks will be back, and they will get their second dose. Thanks, everybody.